Good morning.
Good morning, ma'am.
Good morning. So, today our topic is from stories to skills, using social stories as a teaching strategy for children with autism. So here we have seen many of the many stories, many strategies handling with autism children. So this is one of the effective strategy which we have been dealing with children. The social stories is one of the innovative strategy and it has been effective. So before going into social stories, what exactly social stories is, let us understand what is autism, what are the deficits, and how it shows an impact on it. So autism definition. So autism is both neurological and developmental disorder where it shows affecting people in interaction with others, communication, learning, and other behaviors. So although autism is diagnosed at any age, it can be described as a developmental disorder because symptoms generally appear in the first 2 years of life. What are the areas that are affected? The major areas which are affected are they have impairment in socialization, restricted and repetitive behavior, impairment in communication. So these are the three main areas where there is an delay in children with autism. So let's understand each area, what it is, and what are the areas which are affected. Impairment in socialization. What are the impairments? How the child it is affecting in socialization, in communication, because the child is not able to communicate. He is not able to socialize, and because of that, he is showing in terms of behavior. So, what are those behaviors? Let's see one by one. There's some technical issue going on, just bear with us. So the first, we are seeing the impairment in socialization, impairment in communication, restricted and repetitive behaviors. We'll understand how each slide is going. What are the barriers faced by them? The first and foremost is children on autism spectrum often face unique challenges in communication. What are the challenges they face in communication? The first and foremost is they struggle with speaking. So, how utterance of the word, conveying their message, all these things, they have difficulty in it. And also, they have one of the major difficulties understanding the non-verbal cues. What are non-verbal cues? Like you're giving a gesture, you're calling them like this. They don't understand. They are fascinated by the movement of the fingers. So they don't understand that you're calling them. So this is a gesture, non-verbal cue. So they have difficulty in understanding that, because of which their interactions have become more complex. The second and foremost barrier which they're facing is social interactions. These social interactions can be particularly tough for them. So what are the social interactions? Reading social cues. Reading social cues like understanding your facial expressions, recognizing personal space, understanding the tone of the voice. The facial expressions, the child has difficulty in understanding whether you're angry, you're happy. If you have widened your eyes, they don't understand whether you're angry with them. They have difficulty in understanding the tone of voice. Now you are saying in a loud voice, don't go there. When you're saying, they don't understand whether you're saying them to stop or you're saying in a nice way. They cannot discriminate and differentiate this type of gestures and all. Following norms, for example, taking turn, classroom rules, asking for help, they have difficulty in this. So following norms also, they have difficulty. When you're in a social gathering or when you're in a play group and all, they don't know how to behave. If they want something, they may just go grab it or they may cry. They will not ask for help and all. So these are the social interactions where they lack in. The third one is the behaviors. So most of the time, because the child has difficulty in communication, the child cannot express things, so he is exhibiting it in a behavior. So we have to understand whether it is a behavior or he's trying to communicate something through that behavior. So they may also experience behaviors like a strong need for routine. So they don't like any change in the routine. They want everything to be in a systematic way. They want it, if they are getting up in the morning, going for brushing, then bathing, and then breakfast. So they will not like the change in the routine. They want to have it in the same manner. If you are saying, okay, you have brushed your teeth, now you have breakfast, then take bath, they will show so much of tantrums because the routine of them is disturbed. So this is, they are fixated behaviors they have in the repetitive actions. So they're tapping of the fingers on the bench or table, spinning of a toy, lining up of the toys. They keep all the toys in a line and then again they take it out, again they keep it. So all these repetitive actions. So they take a toy from one room, run to the other room, keep it, again bring it back. So all these things are repetitive actions which the individual faces. These are the barriers. So how to navigate these challenges? How to help them? So most of the time we don't understand what the child is trying to express to us. So we have one of a good strategy. It's important to create strategies that are customized to meet child's individual needs. What are those strategies? So we will explore the social stories that can make a positive difference in the child. So how effective these social stories are, what impact it is leaving on the child, and how the child is responding or reciprocating to it, we will just see. So now social stories. These social stories are research-based behavioral interventions. So they have scientifically been proved and they have shown good results. So what are these social stories talking about? These stories are used interactively with people to improve those particular behaviors in those specific contextual situations. So suppose you want to change the child's behavior. So how will you do it? So you are going to work on the social story. You will plan a social story for that particular situation in that specific context. What you have to do, how you have to behave, all those things, you will train the child through this strategy called social story. So what is a social story? So a social story can be a written guide or a visual guide, which will be describing social interaction, situations, behaviors, skills, or concepts. So you can make a social story with pictures and also describe the picture where the child will understand, where the child will see the picture, visualize the picture, and recognize what he has to do. So what are social stories? So social stories are simple, engaging narratives designed to help children learning important social norms, behaviors, and skills. So these are very simple narratives. They're very customized as per the need of the child, where the child understands how to behave, what are social norms, and how to learn the skill. So this social story was created by Carol Gray in the early 1990s. Social stories have become a vital resource for educators and therapists because it is showing a good result. So these stories are especially valuable for children on the autism spectrum, guiding them to better understand and manage social situations. So let's see how to write a social story. What are the key components of a successful social story? So when you're writing a social story, what are the things you have to keep in the mind and describe the story? Now, social story should be created using three different sentence types. When you're writing a social story, your story should have a descriptive sentence, perspective sentence, and directive sentence. These three play a major role. What we will understand what is descriptive, what is perspective, and what is directive. So in descriptive, it is a well-constructed social story that contains descriptive sentence that provides essential factual information about a situation. Now suppose you have to take the child to a dental doctor or hospital or a school. So you will give a description of what it is. So now suppose you now, as you know, the summer vacations are going to end, the school is going to start. So now you will tell the child, so you have to go to school. Your school is a big building. There are many people in the school. You have lots of friends. You can play in the school. So you're giving a description of the school. So in other words, you are making a readiness skill for the child. You are preparing the child mentally that this is the school. School has these things. You should know how to go to school and what are the things or who are the people in the school. Once you prepare the descriptive, you will make the child understand the perspective sentence. Here the perspective sentence is sharing the feelings and thoughts of others, helping children build empathy and better understand different points of view. So in the perspective, you will say the child, you may be left alone or lost, but don't worry, your teacher will be there. She will help you. You need anything, you can ask help for your teacher. This you are making the child feel the factual things. So in school, teacher will be there. She is the person to approach. She is the person where you can take help and you have friends, you can play. You are giving the perspective of what the school is. And the third point is directive sentence. So after going to school, you're giving a description of the school, then perspective, like what people think of you and what you think and how to behave. After that, directive sentence. In directive sentence, gently guide children on what actions to take in various situations, helping them respond more effectively. So after going to school, what you have to do, how you have to behave. So in the school, you have a classroom. You have to sit in the classroom. You have to listen to the class teacher. When it is a playtime, you have to go for the playtime. When it is a break time, you have to go to the break time. So you are giving a directive sentences. So once you know what your social story has to contain, descriptive, perspective, and directive, then you will understand how to construct a story. Once this is done, affirmative sentences reinforce the value and positive behavior supporting a sense of community. So you will be saying that you are going to school. In the school, you have to behave like this. You are giving affirmations to the child. Affirmative sentence is nothing but being positive about the things what we are doing. So knowing how these elements work together is key to create social stories that truly resonate with children. So once you're clear what a social story is, what are the steps in it, it is easy for you to create a social story. So let's see an example. Now suppose you're taking the child to the hospital. So first you will create a heading, going to hospital. Here the descriptive is, if I will get sick, I have to go to hospital. The descriptive sentence. So as soon as I reach the hospital, I have to go to the OP counter or reception. So this, with visual guide, you are illustrating the child. This is a hospital. After going to hospital, what are the things you have to do? So you have to go to the counter. Sometimes you may have to stand in the queue. So you are giving the description of the hospital. Then, when it is my turn, I have to tell the staff the information they ask for and which specialist I want to consult. So you are teaching the child where to go, how to go, what to do. So once this description is done, the child will go into the perspective things. When the staff gives the OP ticket, I have to pay the cash. After collecting the OP ticket, I have to go to the doctor's room. Still here is your descriptive sentence. The next one, there may be a crowd in front of doctor's room. I have to wait there till the staff calls up my name. So here, what is happening? The perspective sentence starts. When it is my turn, I have to go into the doctor's room and walk towards the chair near the door. So you have to wait for your turn. I have to tell the concerns one by one to the doctor. So I have to answer the questions asked by the doctor. Then I have to carefully listen to the doctor. So this will be your directive, what you have to do there. Sometimes I have to cooperate with the doctor. After the consultation, I have to come out of the room. If the doctor has prescribed any medicine, I have to purchase it from pharmacy. So these are the way you see this story. I have written for a person who is 27 years old. He is aware of it. He can talk. He can express his feelings. He can say he's having fever. He is having pain in the stomach and all. So keeping that person in mind, that autistic child in mind, I have created a social story for him. So now whenever he falls sick, he follows these instructions, though his parents are there, but he takes the initiative to take the token from the OP. Now he has streamlined, he knows how to do it. So this is one social story which I have written for the child, and the same child I have written another social story for supermarket. So here we want the child to be independent. Now he can pick up his things. He knows what he likes, what he doesn't like, what he wants from grocery and all. So his parents are there to assist. They are behind him, but he goes to the market by himself. So before he achieved this skill, this social story was introduced for him. Today I'm going to the supermarket. So at the entrance, I have to take the basket from the counter. Everything it is the child has to do. So you will not talk in the second person's view. You will say in the first, I have to go, I have to sit, I have to do this. So you are enhancing that readiness skill in the child. So after taking the basket from the counter, then you will say that there will be a lot of aisles and choices. I have to search for the items that I need to purchase. So sometimes I don't know what to pick up. Either I need to search the items one by one, or I have to ask the staff of the supermarket to know where the items are kept. So when I ask the staff for help, I have to be polite and respectful. So you should also teach the child how to ask, what to ask. So when the child is asking, you are teaching the child that you should ask in a polite way. After they answer, I will thank them for their help. So these are all the readiness skills where you're preparing the child to understand how to behave by showing these pictures, how to take help, and then be independent in the skill. Then I can take the items one by one. After collecting all the items I need, I go to the billing session. So what you have to do? You collect the items, you take the help of the staff. After collecting, what you have to do? So you're teaching the child the next step. When you go for billing session, sometimes you have to stand in the line. There may be many people standing. So the child should have the concept of money. When you're giving the money, he also should know that he will get the change and all. So all these things are included in the story. So I have to give the required amount to the cashier. If the balance amount is there, I have to collect it and confirm that I received correct balance amount. So when you're introducing this skill, you should also know the prerequisites, whether the child is having the concept of money, addition, subtraction. So all these social stories are customized, need-based. You can make as simple as this because the child's cognitive abilities were good. The story has been little complex for the child, and for him, he understands it. So we could write this social story and successfully implement this. Now the child independently goes to the supermarket. He knows what he has to do, what he has to pick up, where he has to pay the bill. If there is a line, he knows he has to wait for it. So all these things have been achieved with consistent practice. Every day the story has to be told to the child. If the child can read, his verbal, he can read, make him read, make her read every day. So every time the child is reading it, the child is registering it. When you're going to the market also, you can take this social story along with you, show it to the child. So what is the next step? What you have to do? Still the child becomes independent. You have to train the child using these stories. So why social stories are effective? Because they are designed to match visual learning styles. See, most of the children are visual learners. Looking at the pictures, they learn things. So you have to understand whether the child is a visual learner or auditory learner or picking up the skills from imitation, all these things. Once, which is especially helpful for children who learns best with clear visual cues. When you're showing the pictures, the child is able to associate the picture along with the situation. Once the child processes this, he will, whenever you take him to a mall or hospital or school, he is able to understand it. He is able to recollect it and then do it. So they bring predictability and structure to social situation. So you can predict like next what is the step, what the child has to do. So you will be initially giving cues to the child. So now you have gone to the supermarket. What you have to do? You have to take the basket. After taking the basket, what you have to do? So you are prompting the child. Every time the child is performing it, you are appreciating the child. And structure to social situations, helping to ease anxiety for children on the autism spectrum. See, if you observe, if you take the child to some new place, a crowded place, the child shows lot of anxiety. He doesn't know how to behave because he doesn't understand what it is. For you, you know it is a mall. You know people are around. You are very much aware how to behave. But for the child, he is not aware. So he gets anxiety because of which he exhibits certain behaviors. And we feel that the child is showing tantrums behaviors. But it is a way of communicating that he is not comfortable in that situation. So, with the help of these social stories, you are encouraging the child to understand the environment, accept the environment, and proceed in that environment. Once the child understands that, it is easy for him to accept the situation. But if you're just taking the child like that and the child doesn't understand, the child is screaming, shouting, so you feel offended, you're not able to handle the child, then the situation becomes difficult. So these social stories take a lot of efforts in improving the children. And it really works when it is consistently practiced. The child is involving, the parents are involving, the therapists are involving. The beauty of this is you can customize it as per the need and level of understanding of the child. When stories are personalized to reflect a child's own experiences, they connect more deeply and meaningfully with that child. So when you're personalizing these stories, that you are understanding the child what he needs, accordingly you are constructing the story. So it is giving that comfort zone for the child to accept the situation and learn it easily. Until and unless you don't understand what the child needs, then it is difficult for you to work on what you want to. Now, suppose the child doesn't socialize. if he doesn't like crowd and all. If you're putting directly into the crowd, if you're putting in a group of people, he will not like it. He will be shouting, screaming, or running away from the places. So, why he's doing that? So, you should understand that, then accordingly create a story like, okay, the child is not comfortable in the crowd. So, initially, don't put him in the crowd. Use two students, or three people, or four people, a small crowd. Then slowly, once the child is accepting it, increase the number. Then the child will understand, oh, I have to sit in a group of people. So from 4 children to 10 children, so the child feels comfortable. In the same way, anything you are introducing, it should be step by step. If you are just putting the child in a situation where he doesn't know anything and expect the child to behave well, it is not possible. So by focusing on specific challenges, social stories become a powerful way to help children develop essential social skills. So real life examples of social stories. So morning routine magic. So this is one of the important thing and toughest task when most of the parents feel the child doesn't cooperate for brushing, the child doesn't cooperate for dressing, the school time is getting on, he's not cooperating, the child comes late and also imagine a story that walks children through each step of their morning, helping them start the day smoothly. So if the child has difficulty in brushing, so you have to create a story that uh, today morning I am going to brush my teeth. This is my brush. I take the brush, I apply the toothpaste, and I will brush my teeth. So, a readiness skill you are creating in the child. So, once the child understands that, he will be in a position to accept the situation. Rigorously, when you're practicing it, the child falls into a routine. He gets up, he by himself takes the brush his teeth, and do the things in a systematic way. This is the way for each and every task, whichever you feel difficult and whichever field has to be prioritized first. You can identify those behaviors or those areas and start working on them by preparing the social story, by keeping the 3 points in view: descriptive, perspective, and directive. Once when you know what it is very easy to prepare the social story. So learning patience. The child should also learn to be patient. So how will the child learn to be patient? Another story might focus on challenge of waiting for the turn. Many a times you have noticed if the child has to wait, he has very much difficulty in standing and waiting for his turn. He will either grab the things or roll on the floor, scream, cry. So this, with the help of social story, you can train the child to wait for his turn. The relatable moments. These are examples show how social stories can make everyday social interactions easier to understand and handle. So these social stories can be simplified, made easy for the child to understand and easy for the therapist and the parent to work along. Building confidence. As the child is achieving the skill, as he's understanding it, you are building the confidence in the child. By reflecting the situations kids face daily, these stories equip them with the tools they need to succeed. So once you are streamlining the child slowly adapts it. He learns how to accept it. He learns what to do, when to do, how to do. So in this manner, you are encouraging the child and building his confidence by saying, yes, you can do it. The story should be very simple and very easy for the children. Again, the age group matters. If the child is between 3 to 6 years, use more of visualized pictures where the child gets attracted. If the child is between 14, 15 years and above, you can use the written things where the child can also read it. So exploring the benefits. What are the benefits of these social stories? Let us explore and understand what are the benefits of the social stories. So now waiting for the turn. So this is another short story for waiting for the turn. So waits for his turn. So I like to slide down the slide. Once the I like to slide down. Sometimes I have to wait in the line to slide down. So it is not always when you go to a park, it is not you're alone over there. So there are people around, children playing and all. So the child slides. The child has to wait for it. I can wait in the line to get my turn. Sometimes I have to wait little long. When I have to wait, what I have to do? I keep calm when I wait for my turn. So this is one very short story. So you can customize it as per the need of the child. What is the goal you want to do? You can show this story, read it, make the child understand, show him the pictures. You say, see, when the child is sliding, this is you. You have to wait for your turn. And the impact of social stories and social skills. Implementing social stories has shown a significant improvement in social understanding among children with autism. The, when the social stories have been implemented and introduced to children, their understanding has improved, their comprehension has improved, reciprocation has improved. So, social stories have shown a lot of impact when worked consistently. Children report feeling more confident in social situations after familiarizing themselves with social stories. Parents and educators note improved engagement and communication skills in children who use these stories regularly. Social stories can foster independence by encouraging children to apply learned skills in real life context. So once when you introduce these skills, it is not only in that particular situation. When you're teaching one skill, there are so many skills associated with the child learns. So when now the child is going to school, so you have instructed that this is your building, this is how you have to be, this is the school, this is the teacher you have to ask. So apart from school also, you may be going to some music class, you may be going to some sports class and all. So this skill, he will understand, correlate and associate. So if he needs help, he looks around and asks for help. So it is fostering independence in the child because these skills are regularly practiced in the real life context. The results are inspiring, showcasing the potential of social stories. The collaborating with professionals. Working together with speech therapists and psychologists can make social stories more meaningful and useful. So, it is not one person's work. All together as a team, if you collaborate and work, create the social stories, definitely it impacts the child's learning. It makes the child an independent individual. The child understands the concepts. He knows how to behave. He knows to approach people. The child takes initiation in going around and asking for the questions and all. So by sharing our experiences and strategies, we can create stories that better address the unique challenges children face. Getting input from the professionals, it helps ensure that the stories are both accurate and emotionally resonant, making them more effective. So it is not just preparing the social story, creating that readiness skill in the child, and just introducing it and leaving it. So you have to take the inputs, the feedback from the other therapists also, how the child is responding to that particular social story. If the child is having difficulty in responding it, identify where the difficulty is, simplify the story over there or break it into another small step. Maybe the child is having difficulty in understanding that step. So simplify that step because you can customize it as per the need of the child. So you can simplify that as per the need of the child. So building a strong support network can empower both children and their caregivers as they work on developing social skills. So this support system empowers both children and the caregivers. Once you know the feedback, once you're associated with the therapist, educator, and working as a team, the inputs and the feedbacks help us for a strong support system in enhancing the development of the child. As more people recognize the value of social stories, there's potential to introduce them in a wide range of educational settings and therapies. Most of them, very few people are aware of social stories. So we have to bring that awareness in the children. We have to bring that awareness in the parents, therapists, the importance of social stories where the children are really benefiting it. So you can use technology like apps and interactive media can make social stories more accessible and engaging for everyone. So you can create a social story in the tab. You can give the audio for that and play the story. So the child will listen to it. The child likes animations, moving objects and all. So the child will try to grasp it, understand it, look at it, what is happening in the picture. So that also enhances the development of the child. So potential challenges. What are the potential challenges and how we can overcome it? While social stories are helpful, implementing them consistently in different settings can be challenging. So you have to see the settings, the environment, the people, everything, consider it, and then work on it. Parents or educators who are unfamiliar with social stories might be hesitant or they might be skeptical about using them. So, when see anything new, when you don't know, you hesitate it. Until and unless we don't try, we don't experience it, we don't know how good it is. So, these social stories are really effective, really result oriented. Most of the children have improved in their social behaviors. The regular evaluations and feedback ensure that the stories stay relevant and effective. Overcoming these challenges is crucial for the successful use of social stories. Social stories are a valuable tool that can help improve the social skills of children with autism. Their clear and relatable structure helps children understand social situations, making these interactions less stressful. So, you are helping the child to be ready for that particular skill. So, you are creating an awareness in the child. You are helping the child to understand what is the situation. Because of this relatable structure, it is becoming easy for the child to understand the steps, follow the steps, and work on it. So we have a feedback form. So I request you all to fill the feedback form and give your input so that we can improve the questions you have.
Ma'am, is there any specific age uh, with autism children start the social story? For example, I have an autistic child. She is of 4 years old, but she's not ready to, she's not responding to her name or she's not calling Baba, Mama. She know that they are my not parents, they are the someone who she's attached with, but she don't know the emotions or relationship. Even she's hungry, she cannot express it. If
Yeah,
somebody is eating, and is for that kind of children, is it relevant to use social stories, or yet we have to wait?
you can use it for them, but again you have to customize it. Now you are saying the child cannot express, she doesn't respond to name call. So you can create a social story by putting the picture of the child. This is me.
Okay.
My name is suppose John. So I am hungry. You put a picture of food. I am hungry. When I am hungry, I have to ask for food. So you can mix one sentence also. The beauty of social story is that. So when you're introducing it, keep the child in the mind, the level of the child, and put it as simple as you can. So definitely it will help. So here I have a question. How can social studies help in reducing anxiety in children with autism? So it is social stories. You are enhancing the child or encouraging the child for a readiness skill. You are making aware of the for the child that you are going to this place. So this is a playground. You see many people over there. There are people who come to play football. There are people who come to play the slide, swing, and all. So you are giving an orientation to the child, how the park looks, what are the things there in the park, what the child has to do in the park. So when you are introducing it, when the child goes to that place, sees that environment, the anxiety level reduces. You cannot say you can eradicate that anxiety level, but definitely the anxiety level reduces because the child will be associating what he has read in the social story with the real environment. Any questions? So we have one more question here. How often should the social stories be updated to remain effective for a child? See, once you have introduced the social story, even without the help of the social story, if the child is able to perform independently, then you can update the next one. You can add the next. Now, suppose you are teaching the child to wait for his turn. So waiting for his turn doesn't come only in a play area. It might be coming in the uh, say ports or malls where you have to wait, stand in a line and play for the bill and all. So in these situations, you have to generalize the things. Otherwise the child will think I have to only wait in the park, only to slide for the park. I have to wait for my turn. No. Once you feel the child is able to perform that task, what is the next level, the complex level, where he has to wait for a longer time. This is how you can update it. So if somebody is having problem in filling the feedback form, we will just rectify it. Okay, fine. It shows that it's only for people in the, no, it is not like that. So the feedback form will be accessible to all of you. Any further questions? I hope this is helpful for you all. Feel free to ask because this is for the benefit of the parents, therapists, teachers, and all. A new strategy, really
So,
effective.
Madam, the visuals used in making the custom-made social stories, I noticed that most of them are 2D pictures. Can we also use real-life pictures so it's more realistic?
You can use real life pictures also, provided how the child receives it. See, what is a picture to you may not be a picture to the child. So you have to understand the child is able to associate with that real life situation. You can definitely use it, real life situations. Definitely you can use it. Somebody is
Ma'am, I
noticing.
have a doubt.
Yes, ma'am.
Ma'am, this social stories is useful for younger children or teens also?
For all, ma'am. That is what I'm saying. You have to customize it as per the level of the child. Any small goal you want to teach, you can prepare a story as per the child. If the child is 4 years, the one of the parent has asked like the child doesn't respond to name calling. So you can prepare a story where the
Okay.
child can understand it. Now you can put the real picture of the child. This is me, this is my name. So whenever you're saying the name to the child, you will be little louder. You will say that, oh, this is John. So when you say that, the child starts auditory processing, the child starts listening to it. You are pointing out the picture and saying this is John. So it is a small story, a 2-line story, 3-line story. Yes, if it is an elder child, 11-year-old or 15-year-old, as per the need of the child, which story you want, which skill you want to develop, you can construct the story, provided you have to follow these 3 things: descriptive, perspective, and directive. If these 3 things are in align, your story becomes very easy.
Thank you, ma'am.
Yeah. Any questions? I hope this was beneficial to you people.
Definitely, ma'am.
Thank you so much. Any feedback and all, any questions, you all can just put it. We will respond to you people.
Ma'am,
Hello,
any
ma'am.
specific websites?
Pardon?
Ma'am, any specific websites to get the pictures, ma'am?
No
For
specific
this
websites,
session.
like you have to browse and get the appropriate pictures and all.
Yeah, okay. Because you're showing that the hospital and the supermarket theme,
Yeah.
right?
Yeah.
For
So
that, I'm
yeah. I have worked for a
I
27-year-old
understand
child.
fully depends
So
upon the needs of the children only.
yeah,
I'm just asking any specific websites for the pictures. That's why I'm asking, ma'am.
pictures you can generally take the pictures.
Okay. Thank you so much, ma'am.
You're welcome.
Thank you, ma'am. It was a very useful session. We understand more about social story. Thank you for sharing your valuable knowledge.
Thank you so much. So please give your feedback so that we can come up with many more such strategies which will be useful for all the children.
Sure, ma'am. We are looking forward for many webinars from your side. It much
Sure.
Hello,
appreciated.
ma'am.
Yes.
Hello,
Yes,
Ms.
sir.
Aparna. I have
Yes.
one small question
Yes,
that,
sir.
as you mentioned, we can use our child's picture as they are autistic.
Yeah.
I want to know uh, the topic of the generalize. If we use our realistic picture, so child can confuse in the public, like for example, the symbols in the publics are different, you know.
Yes.
So if we
Yes.
make our stories for the realistic, specifically his own pictures, and he will not find out in the outside exposure. So it can
Yes.
be confusing for him
Yes.
to
It
be a
can.
generalized.
It can be confusing. So initially, you will always start with the basic symbols. Then you
Okay.
will keep the next symbol which is shown more in the public places. So this symbol is associated with this symbol. Now suppose for using the washrooms and all, you have the symbol of a male and a female. The picture is there. In some places it is in red color, in some places it is in green color. So the child will get fascinated with the color. He may not see the picture. So he will only associate it with the color. So
Right.
yeah, so when you're teaching it to the child, you should be very specific. This is the symbol for washroom. This is boy. It may be in red color or green color or blue color also. Some of the places we have seen in blue color also. So it may be any color, but focus point is the image of the boy or the girl over there. So
So you mean we have to introduce the options as well, right?
yeah, so initially you will start with simple. It is a strategy again. Simple to complex, concrete to abstract. So once the child is able to learn from simple, you will introduce the complex thing. Once the child is able to understand the complex thing, then you will go to the concrete concept. Once he understands the concrete concept, you are going to abstract. So that is, you will generalize the situation. You can take a simple example. You say apple is red. Right. So initially you're teaching the child that apple is red. What are the things that can be red? Whenever he sees anything red, he will associate it with apple, or he will say it is apple. But when you generalize the concept, it is not only apple that is red, the shirt he wears is red, the cap he has is red, the bag he has is red. So you are generalizing it. The chair he sits also might be red. Initially,
Yes,
you're teaching the
right.
color associating with the fruit because it is concrete.
Yes,
The
right.
the
Yeah,
general things will be the other things which are not regularly available or which is using on a daily basis also.
all right. Thank you.
You're welcome. So no further questions?
Yeah, it was wonderful information regarding the social stories. And do you have in the start, I missed some part. Did you mention some specific different types of social stories according to the age?
No, no.
No. Okay.
See, this you have to customize, sir. It is
Mm-hmm.
the child's age, the child's need. See, most of the things are need based. Until and unless you don't satisfy that need, the child will not know its importance.
Okay. Usually
Only
we
when,
start with the pictures, right? Initially.
yeah, initially you can start with the picture. If the child is verbal, the child can read, comprehend it. You can make the child read the social story.
Right. Absolutely right. Thank you. It was
Yeah,
wonderful, amazing. I hope
thank.
it will continue.
Yeah, we will continue it. Thank you so much. I think so. Thank you so much for your active participation, taking time and listening to this. It encourages us a lot. So with this note, I close this session. I hope I answered all your questions. Thank you so much.